so with it. Thank you, Anthony.
Thank you.
It wasn't too bad in there, was it? Good. The music.
Second time is not as bad as the first.
Good.
First I was terrified.
Were you?
That's a small hole.
Have you ever had an MRI?
No.
It's even smaller.
Hmm.
I mean, this is as big as a CT scanner. It's just a little bit longer. Okay. But an MRI is even longer yet, but it's a much smaller hole.
Really?
And it's loud during the whole thing. Brrr. It sounds like a jackhammer next to your head.
Oh, really?
So they always give you, like, earplugs. I used to be an MRI tech too. So about at least half of the patients already have some sort of anxiety about it. But
what is an MRI machine for?
just a different way of looking at your insides.
I wouldn't need one, right?
I doubt it. I think they can get what they need from PET CT and CT. This doesn't take the place of a diagnostic CT. You still might have to have that, especially if they're going to do surgery or something,
No,
but if they're going to do
radiation.
what radiation,
Yeah.
they're going to use the images from this
to target the areas.
Exactly.
I don't think there's going to be any surgery involved.
So I'll give you your CD here. It's just finishing up, and then you're on your way.
There you go, sir. A little nice little packet like I got last time. A little picture and stuff. Thanks.
You take care. I got it.
All done. You can go back to eating and drinking like normal.
That's awesome, because I'm starving.
¿Y cómo se mira cada dormir? Ah, no lo podía saber.
What's that?
It's a library.
Library? For what?
I think if you need to use a computer.
something from a movie.
Yeah.
Quarantine area. Zombies. I can work from here. Yeah, thanks, buddy. Thank you.
Well,
Anything else?
no, well done.
And you're home?
Yep. Well done, okay?
Thanks. Let's go.
Yeah. Did you have fun? Fun?
Oh,
Did
yeah.
you
It
have
was
fun?
a blast.
It was a blast, yeah.
Blast. Thanks, friend.
You too.
I'm gonna see if I can get a free massage while I'm here.
Huh?
I'm gonna see if I can get a 15-minute massage.
Right now?
Yeah, they're right here.
Oh. Okay, we'll be in the gift shop then.
Okay,
Okay?
okay. Cynthia's not here today, huh?
Who isn't?
Cynthia, massage?
No,
Oh,
Wednesday
Friday.
afternoon and Thursday
Thursday,
morning.
Thursday.
Do you want me to call and see if she's around in the building?
Yeah,
Okay, what's your name, sir?
Anthony Barry.
Okay, I'll check.
If she's available, I appreciate when I just had a treatment thing.
Using it like take it. I remember that.
All I got was her voicemail. I left a message, so I don't know what you want to do.
It's okay. If she's busy, it's not a big deal. I was already here. I thought I would
I'm not
ask.
even sure she's in the building, you know? know, I just thought I'd give it a try.
Which one's Georgianne? Is she here?
Georgianne? Who's the nurse? Did you need to speak to her?
I just don't know who she is, and it keeps corresponding.
Yeah, I know you guys keep on emailing back and forth.
Yeah.
Perfect.
Oh, sorry. She's sorry.
How you doing?
I'll be right out.
Thank you.
Hello.
Oh, you're Georgianne.
Yeah, I'm the one that was in the room and did your history that
Oh,
day.
I'm sorry, I didn't remember.
That's okay.
So.
So how'd it go? Okay.
I just did the PET scan.
Yeah.
I just emailed Dr. Saki,
Mm-hmm.
and the ENT said that the tumor's grown a little bit. He says he's not really concerned about obstruction
Okay.
if it was to swell, but I kept prodding him. Are you sure? Are you sure it's not going to swell and I suffocate? And I kept asking questions like, if it does swell, does it swell really, really rapidly, and then I'm stuck at home suffocating? And
Usually
then
it's not swelling, it's growing. It usually won't swell.
Okay, well, he said he doesn't think I'm gonna need it. My airway still looks good. Not as better as it was 6 months ago, but he says he didn't see a problem, but he recommends a trach if the doctor thinks I need it. If they believe that the radiation is going to cause it to swell up because of the radiation,
Not normally.
I could asphyxiate.
Yeah, not
choke.
normally. Radiation shrinks it.
Well, in certain cases, I've been told that the tumor will just swell a little bit because of the first radiation.
Not normally.
Not normally. It's
Never
just,
seen that happen.
As soon as it hits it just starts shrinking instantly. Huh? Really?
It may give you a sore throat, but it doesn't normally make the tumor swell.
Really? Okay. Well, where he said it was around the area of the actual breathing part. It is growing down in there. Before it was kind of just growing up. Now it's kind of growing down. So I used to have this much, and now I have about this much. So if it was to swell at any point, I could
Then
do
you'd
an
have to call
emergency trach.
911.
Yeah.
Did you get your dental work done yet, or get your dentist seen?
I'm gonna see him today. I'm going right now. But what are the chances of it swelling? Should I need a trach again? Have him install a trach anyway? 'Cause
Not at this point.
I don't want to have to go through all that too.
Yep, not at this point. I've never seen anybody have to be trached for treating their head and neck.
Really?
If we do larynx, where they do a laryngectomy, then they have a trach, and sometimes because of the surgery.
Mm-hmm.
But I've never seen us have anybody have a trach.
Just because I have a tongue-based tumor?
Do them all the time without any trachs.
Really?
Mhm.
You never had anybody had problems? As soon as it starts,
Sore
it's
throat.
sore throat, but it starts shrinking.
It starts shrinking.
Because as soon as it
That's
starts
the
shrinking,
point
I
of
get a
radiation.
bigger airway.
That's
So.
the point of radiation.
Okay. I need the referral because I never got a referral to chemo.
You can't go to Dr. Cavalcant because they don't take your insurance. I called Dr. Obenchain's office. They are supposed to be calling you and setting up an appointment.
When is that where are they at?
They're in Chandler, but they're not part of Ironwood. They're separate.
Oh.
But it's Dr. Robin Obenchain.
So there's no way for me to go here and then go across the street to get. This is gonna be tough.
Because they don't take your
Insurance
plan.
access.
Right.
I wonder why you guys do and they don't.
Because the hospital takes it.
Oh, and they're not a hospital.
They're not part of, they're an
They're third
independent
party.
practice.
Oh,
So they have the
okay.
right to take or not take anything.
okay. So you don't think I need a trach then?
They don't.
And let's just take worst case scenario. If it does swell, it'll swell gradually. It just won't like swell overnight, and I'll just
It
start
doesn't
choking.
normally swell, period. I mean, that would be really unusual.
I have an unusual tumor from what he says. He says every time I see him, he says, "You're still alive."
Well, yeah, because you,
I've had it for 3 years. Most people die with it in months.
well,
Well, not this long at
but
least.
yeah.
and they still
But
swallow
you
or
need to
still
get
eat.
it. You
And,
need to get it treated,
Well,
or
yeah.
you can have airway problems.
yeah, well, I'm gonna either. He said I'm either gonna, what do you call it? I'm gonna either asphyxiate. I'm gonna choke to death because it's gonna block my airway,
Right?
or it's gonna get cut and I'm gonna hemorrhage.
It's going to eat through one of your arteries as well.
True, yeah. Where he says if I eat something sharp, the tumor's just gonna cut one of those veins, and it's just I'm gonna hemorrhage. There's nothing he can do. Right now, he said even if you're bleeding right now, there's nothing I can do for you because there's no way for me to
Right, because
actually.
it's too friable a
It's
tissue.
yeah, and there's too many veins in
Well,
there.
let's see what your PET scan shows, and you get your dentist taken care of, because we
Okay.
can't do anything until you've got that dental eval.
Okay, so I'm gonna get that taken care of today, and let's say all that's done. You get the dental eval Monday. You have the PET scan results Monday, CT scan Monday.
We'll set you up then for an appointment to come in and get your planning session done.
Okay, and I should be able to start when?
I can't give you an exact date, because it depends on when I can get you in, when she's here,
Okay.
that kind of thing.
Okay.
So, yeah, you gotta get your dental.
But we're gonna start radiation first, and then we'll do the chemo.
I don't know, I need to call Dr. Obenchain's office and see what's going on with them. Have you got, Annie, can you give me Obenchain's number real quick?
It is
And he's American, right?
480-855. 5886.
I knew that number sounded familiar.
Is the dietitian, is she in today?
Yeah, I don't know if Lillian's got somebody in her office or not.
Okay. I'm here. I might as well kill several birds with one stone.
Hi, this is
What's
Denise
this for?
from Dr. Taylor's office.
It's people scan in when they're on
I was
treatment.
just confirming.
They
that
scan in
this
so that the
appointment-
therapist in the back knows that you're here.
Do I get a card or something when I come in to do that? Oh,
You know where Lillian is right there.
thank you.
Mm-hmm.
Hey, everybody. I just called you.
I'm sorry.
It's okay. I didn't realize you were here until just a minute ago.
Yeah, I was getting my PET scan done.
Oh, how did that go?
Oh,
Did
it's
it go okay?
not a good experience,
Oh, I'm
but
so sorry. But you got it done?
yeah,
Oh, thank goodness.
I'm praying that that it all comes out clean. It's just
Yeah.
still in my neck.
Yeah.
Because if it's in my neck, then it's treatable.
Mhm.
So,
Mhm.
the ENT doctor said something about a trach. Do you know anything about those tracheotomies?
No, not really. I'm not the person to talk to about that.
Second-
Why did he think you'd need that?
Well, the tumor was growing upwards
Oh,
as of 6 months ago when they checked me. Now it seems to be growing down into my esophagus.
so does he think that's going to cut off your airway, or?
Well, in very rare occasions, sometimes the tumors swell
I see.
at the beginning of the process because they react.
Beginning of the treatment.
Yeah, they swell.
Oh,
And if it
interesting.
swells, then it could cut off my airway. Then I'll have to have an emergency trach, which is pretty invasive. So but I just talked to Georgiana, and she said she's never had any person with what I had ever need a trach. So
So let's hope your chances are slim to none.
yeah, so I was really worried about that. I'm like, I don't want the feeding tube, and I don't want the trach.
Well, you know, they always have to tell you the,
Worst case.
every possible thing that could ever happen. I mean,
Question. All the Ensure that you gave me, would I be able to swap some of that stuff out for the one that you recommended? Because I love that stuff, but I actually grabbed one that has the same exact label, and it was strawberry, and I almost threw up.
Oh, I didn't like the strawberry.
Oh, it was
one?
horrible.
Oh my goodness.
And there was
so which
only one
did you
chocolate
like?
in there.
You like the chocolate one though?
It's the only one I
I'll get you
like.
some more chocolates. That's
Could
no
you?
problem. Yeah.
Could you?
Yeah, let me go grab some while you're
Okay.
here. No problem.
The Ensure chocolate, because I have the Boost chocolate too. Does it
I
matter?
have the Boost chocolate. I the Ensure one you showed
Okay,
me.
yeah, I'll
It
get
was
you
up
more.
there.
I have more of the chocolate Ensures.
Yeah, the chocolate one. Thank you.
like those.
Oh, I love those. These
Yeah,
are actually
good,
better than the
good.
other ones.
Oh,
Thank
really?
you so
Isn't that
much.
something? Now,
Yeah.
you said something on one of your emails about a blood sugar machine. Is your doctor wanting you to test your blood sugars, or what are you
Well,
thinking
what's
of?
funny is that the guy just took me, and I had like not so good stuff, plus 2 of these yesterday,
Uh-huh.
and my fasting sugar today was 82.
See, so it was fine.
So, and that's
Yeah.
weird because
Yeah.
I think
Well,
I
your-
overdo it
Your
sometimes.
fasting blood sugar doesn't always reflect what you had the night before, though. It could be high sometimes in the morning if you don't eat enough for your evening meal.
Well,
Okay.
she
If-
promised me a machine.
Machine, okay.
I have a machine actually that I got years ago,
Okay.
but the strips are like 3 years old and they've been
Oh, yeah.
sitting in the garage at 120 degrees.
Okay, then they're not going to be accurate.
Well, yeah, because what happened was I used the one that came with it. It's always been in the house, and my blood sugar was always like 90, 100, 110. And then I opened up the new box from the garage from the summer, and I used that strip, and it was like 420.
Yeah.
So it jumped from 120
That's
next
because
night.
the strip is bad.
The strip was bad, yeah.
Yeah, it's just the strips.
So, is there any way that you could help me get a meter and some strips?
You know, that's not something I can, there's nothing I can do to get that.
No, I just gotta talk to my
You
GP.
know, it depends on your insurance, because I think in the state of Arizona, each insurance